Hello everybody, and welcome to episode 1 of the student-led NCLEX Prep Crash Course. Today we're going to be talking about hyperkalemia. But first, I have to get into character, okay? Now that I'm in the proper attire, as your host, Classy Massey, I'm going to head inside and see if I can find some of your fellow students. We have the finals coming up, so some of them are most likely upstairs studying, and we have class in about an hour, so we'll try to find some people and see what they can teach you. Come on with me. Come on in.
You got us in.
Hey, how are you?
Good morning, Miss Files. This is Miss Files at the front desk. Wave hi to your fans.
Welcome to the College of Nursing. What are you guys up to today?
We're here to teach students about hyperkalemia, so we're going to find some fellow peers and see what they can do.
Ooh, good luck with that.
Thank you.
Have fun.
So we have our first victim. Do you mind if I ask you a few questions?
Sure.
Okay, let's head on in there. We got a professor, 1 second.
Okay, sure. Sir.
What does hyperkalemia mean to you?
I don't know, but I'm getting palpitations.
Okay, I guess you heard it, folks. Thank you, Stephanie, for joining me today. My question for you is, what is the pathophysiology behind hyperkalemia?
Okay, so potassium is an essential electrolyte in the body. It is important to keep this potassium between 3.5 and 5.3 millimoles per liter in order to keep the nerve and muscle cells functioning properly. Usually potassium is taken into the body orally from foods or in forms of intravenous fluids. It's excreted in the urine to keep the body in homeostasis. When the amount of potassium in the body or in the blood exceeds 5.3, it's called hyperkalemia.
Okay.
There are many things that can cause hyperkalemia. Renal failure, heart failure, diabetes, anuria, lactic acidosis, potassium-sparing diuretic, and NSAIDs. All of these cause the buildup of potassium in the blood due to the fact that they are preventing excess potassium from being excreted from the body as waste in the form of urine. So another cause of hyperkalemia can be caused from trauma and burns to the skin. When this happens, potassium shifts from inside the cell to the outside of the cell and into the blood serum, causing a higher level of blood potassium. The muscle that is most affected by hyperkalemia is the heart. It causes cardiac abnormalities such as palpitations, AFib, and even cardiac arrest. Other symptoms include nausea, vomiting, skeletal muscle weakness, and paralysis.
Okay, thank you very much.
Thank you.
On to the next. So now that Stephanie told us the pathophysiology of hyperkalemia, why don't we head on upstairs and see if we can find anyone else to kind of elaborate.
I'll send it out.
Ridiculous! So we're on the 6th floor currently. This is where a lot of students study. So we're just gonna have our quiet voices on and we're gonna go see who we can find. Let's go. All right, I found a student. Hey Stan, how are you?
Good, how are you?
Wow!
Finally I got it!
Oh my gosh!
Finally, oh my goodness, I worked for all morning on this, figuring things out.
Okay, so I actually have a question for you.
Yes, ma'am.
It's about hyperkalemia.
Hyperkalemia, oh my
Yes.
goodness, that sounds scientific.
Yes. So my question for you is, how can you better manage hyperkalemia?
Hyperkalemia. Managing it's easy, I think. It has two ways, with medications and with managing and watching your diet. Hyperkalemia, it's usually asymptomatic. Some of the ways to manage to lower the hyperkalemia is diuretics medications. they might be helpful in excreting the high potassium from your body.
Okay.
Gastrointestinal cation,
Okay.
which is called patiromer, may be helpful
Okay.
in some clients with renal insufficiencies.
Mm-hmm.
Hemodialysis should be also effective
Okay.
in somebody who is in end-stage renal diseases. If we go with the diet with the non-medication type, there are many foods what you can watch for.
Okay.
Especially one of my favorite ones is the tropical fruits, avocado and banana. Everybody's favorite ones.
Yes.
Which we are, exposed on daily basis, having them, on our menu diet daily.
Mm-hmm.
I think that the avocado, bananas, salt intake in your diet, watched carefully, can help with reducing significantly in those numbers.
Okay.
Also, I think when you go on camping, this is just healthy advice for everybody.
Here we go.
We can also lower the canned food. The canned food is very high in potassium.
Did
I
not
think.
know that.
Yes, the canned food. So it's very healthy. So we can also preserve the nature by not having so much canned material metals.
Environmentally friendly.
Yes, environmentally friendly.
Okay.
That's the word what I was thinking.
Yes.
Saying. And try to enjoy the foods as much as you can.
Yeah.
Just make smart choices.
Okay.
Thinking hyperkalemia.
Hyperkalemia. Right there, folks.
Zoom up the K.
All right.
Let's see, oh my
Thank you very
goodness.
much, Stan.
Thank you, my pleasure.
Yeah, we're going to go find some other
Woohoo,
people and
yes.
have them teach it too. So, all right, nice talking to you.
Thank you.
All right, on to the next. Here we go.
Wait.
Oh, yeah.
I didn't mention coconut water. Watch for that. It's full with high potassium.
Okay.
People watch the coconut water. It's tasty, but watch for it. Will help you reduce those numbers. Yes. Thank you.
Okay. Hello. So I think I found another student studying, as we all should be, right? Anyways, let's go in and see what she can teach us. Oh,
Hey.
hi Megan, what you doing?
TikTok break.
Oh, okay. Well, I actually have a few questions for you, if that's okay.
Sure, what's up?
All right. My question for you today is, what are some recommendations for the nursing practice as far as monitoring labs and monitoring the patient and immediate treatment goes for hyperkalemia?
Okay, so the first thing, obviously, what we're going to do is look at our labs. I'm sure everyone said that.
Yeah.
And we know our normal range is 3.5 to 5.3. Hyperkalemia is defined as a serum potassium level above the upper limit. So that's going to be like about 5 to 5.3 and anything above that.
Okay.
Mild hyperkalemia is often asymptomatic, so that causes some issues with us identifying hyperkalemia. But super high levels can be life-threatening, and that becomes an emergency. It's also to be aware of our patients who are at high risk. So has anyone else talked about like what those patients look like?
Just briefly, so.
Okay, so those would be our patients in the hospital who may have renal failure,
Yep.
diabetes, CHF, alcoholism, and also severe burns is a
Oh,
big
wow.
one.
Okay.
We haven't seen too many of those on clinical, but you never know. And if you suspect any of these patients have hyperkalemia, you're going to want to make sure you definitely initiate IV access, which we do with a lot of our critical
Yes.
patients anyway, and also make sure you have your cardiac monitoring set up. Okay. So the most serious manifestations we're going to watch out for any of our patients with hyperkalemia would be muscle weakness, paralysis, cardiac conduction abnormalities, and cardiac arrhythmias, which is why we want to set them up to their cardiac monitoring if we suspect that might be an issue. And people with chronic hyperkalemia, like the patients at risk that I mentioned before, these manifestations usually don't occur until their potassium concentration is 6.5 to 7.
Wow.
But at lower levels for our other normal patients, they can be getting these super serious effects. So it's something to be aware for. Other common symptoms that we should be aware of and looking out for in our patients are nausea and vomiting, chest and abdominal pain, diarrhea, and general fatigue, like everything else is general fatigue. It's super important to monitor our patients for these symptoms and to initiate treatments as soon as hyperkalemia is identified so that it doesn't turn into something more serious and the life-threatening symptoms that we mentioned.
Okay.
And I guess we could talk about a couple treatments if you'd like.
Sure, yes.
Okay, cool. I'll write them up on the board.
Okay.
So I just wrote some of the treatments up on the board here. Sorry for my busted handwriting. First we have IV calcium. So IV calcium is going to be for our serious life-threatening cases when their levels are super high. And this IV calcium is going to go in through that IV access that we talked about that we want to initiate. And this is going to protect against the malignant cardiac hyperexcitability and those cardiac abnormalities that we talked about earlier. Next we have insulin and glucose. So what this is going to do is promote the reuptake of glucose into the cells, and it's going to cause an intracellular shift of potassium. Next we have beta-2 androgenics. This is also going to cause a cellular reuptake of potassium. Then we have diuretics. So this is going to cause potassium loss via the kidneys. And the last thing we're going to want to do is discontinue our potassium-sparing drugs and also discontinue dietary potassium, which I think I heard Stan yell about in the hallway before.
Yes, you did. Well, thank you very much. I hope the students learned a little bit about hyperkalemia, and yeah.
Okay.
Well, potassium to you too, then. So we're currently in the St. Joe's College of Nursing Library, and I'm joined today by Mr. Peter at the front desk.
Yeah, anything we can help you find to get your research papers done, from books to magazines to interlibrary loans, let us know.
All right, thank you very much.
Thank you.
Have a good day. I think I see a student studying. Let's go. Finally, someone that is actually studying. I actually have a question for you with regards to hyperkalemia, if you don't mind. Sure. What are some impacts on the individual and the family with regards to hyperkalemia?
Great question. So individuals with mild to moderate hyperkalemia could potentially be asymptomatic, which is why hyperkalemia is often discovered during lab screenings. On the other hand, those who do experience symptoms often show signs of muscle twitches, which can lead to cramps, and then paresthesia.
Okay.
Other signs and symptoms of hyperkalemia include irritability and anxiety, low blood pressure, EKG changes, dysrhythmias, which can lead to irregular heart rhythms, and we'll touch more on that in a little bit, abdominal cramping, and diarrhea.
Okay.
The most lethal complication of hyperkalemia is cardiac abnormalities, which can lead to dysrhythmias and even death, which is why it's so important to identify it early on. Knowing these potential dangers can cause a lot of stress on both the patients and their family. Some patients are actually at a higher risk of hyperkalemia. Have you guys talked about patients who are at a higher risk yet?
Just briefly, but if you want to elaborate for everyone.
Sure. So to touch on one, hyperkalemia is a common diagnosis in patients who have kidney disease due to the effects of kidney dysfunction on the potassium balance. And thus this condition strongly impacts the quality of life and prognosis of the patient. A good support system would benefit the patient during these times, whether it be family, friends, or members of the healthcare team, to provide emotional support and therapeutic communication.
All right, everyone, that concludes episode 1. I hope that you all learned something about hyperkalemia. I'll see you next time for episode 2, so see you later. Yeah.
YouTube.